In this micro lecture, what we're going to be seeing is an overview of different analogies or effects in the field of orthodontics. So you have many concepts of phenomena in orthodontics which have been explained using analogies, or they've simply drawn inspiration from day-to-day living examples. Now, this is a fun micro lecture because it's very similar to your oral pathology, where you have a number of appearances, right? You have your cobblestone appearance, orange peel appearance, or cotton wool appearance. Similarly, in orthodontics, you have a number of analogies which help explain certain concepts in an easier way, but it's also important to identify where these effects are seen or what is this effect concerning. And this is exactly what we shall be studying in this micro lecture. To start off with, what is an analogy? Analogy is simply the comparison of two things which have some kind of partial similarity in order to explain the way something looks or the way something functions or the working mechanism of any particular concept. Now, why are analogies fun? Analogies are fun because using something similar, you're able to describe an effect. Say in this lecture, we will be studying about the different effects in orthodontics. Using a particular analogy, you're immediately able to explain, oh, this is how this happens. Where is it seen? It helps you remember these things in a much more easier way. Before we jump right into the micro teaching lecture, first let's enlist what are we going to be studying in this micro lecture. So we're going to be studying a number of effects that are seen in orthodontics which have used analogies to explain certain phenomena. So you have the drawbridge effect, you have the wedge effect, door wedge effect, washboard effect, trampoline effect, fence effect, roller coaster effect, wagon wheel effect, watermelon seed effect, cue ball effect, rowboat effect, and ripple effect. You might be familiar with a few of them, but it does seem like a large number of effects, but it's been simplified for you to understand and also remember in an easier way in case any MCQ based on these analogies come up. First, let's look at the drawbridge effect. Before understanding what this effect is per se in orthodontics, let's first look at what a drawbridge is. A drawbridge is a picture that you see here. I'm sure you're very familiar with the picture like this if you've seen them in movies or if you've been a tourist visiting places that has a drawbridge. It's very simple. It's basically a bridge. It has two halves. It has movable halves, or basically it's just a movable bridge that can be raised up or it could be let down. When it's raised up, it allows the passage of ships and other tankers to go through the bridge. When it's let down or closed, then it becomes a straight bridge again, which becomes a road for other vehicular movements to happen. Now, what is to be noted here is the movement of the drawbridge. It can either be raised up or it can be closed. Now, similar to how a drawbridge is closed to become a straight road or a bridge again, a similar kind of tooth movement is seen when one closes a dentoalveolar open bite. So sometimes dentoalveolar open bites of moderate severity are treated with extractions where the incisors are both extruded as well as retracted. And this is very similar to the closing of a drawbridge, which you can see by the black line that's pointed on the long axis, along the long axis of the incisor. So it's both being extruded as well as being retracted to close a dentoalveolar open bite, which is very similar to how a drawbridge is closed to become a straight road again. Now remember that it can only be done in dentoalveolar open bites of moderate severity, and such tooth movement is beyond the scope of severity of treating skeletal open bites. So this is the drawbridge effect. Let's now move over to the wedge effect. Wedge is nothing but a triangular shaped tool, which I'm sure many of you have seen. It works on a portable inclined plane. It helps separating objects. It helps holding or stabilizing objects in a particular position or to lift objects, etc. If you've seen, a wedge is usually used when somebody is hammering on a log of wood to cut it into two halves. The hammer is usually being hammered onto this triangular wedge that helps to wedge it out or separate the log of wood into two halves. Now, a very similar wedge also exists in the mouth, and the effect of this is seen when we close a open bite. So if you imagine a wedge, the tip of the wedge, or in essence the wedge or the tip of the triangle, is bordered by the posterior maxillary and mandibular molars. That is where this wedge is present. Now, if you want to close the open bite, The wedge effect hypothesizes that extracting posterior teeth where that tip of the triangle is, if you see in the diagram also, extracting posterior teeth, most often it is the first molar extraction that's proven to be the most effective in closing an open bite. Even the second premolar also shows good results with closing an open bite. So extracting posterior most teeth, mainly the first molar or the second premolar, allows this wedge to be closed or allows the mandible hinge to be closed, thereby allowing a better vertical control in open bite cases. Now if you see, the black triangle or the black wedge is when that open bite was there without extractions. Now if you extract the cross marked teeth, either the first molar or the second premolar, the wedge kind of closes, or the mandibular plane angle closes to make it become a smaller wedge, and this is called the wedge effect. It helps to describe how an open bite can be closed by extracting posterior teeth. From the wedge effect, we now move over to the door wedge effect. Now imagine there is a loose door or a creaky door. What do? We roll up a piece of paper and place it from underneath, wedging the door such that it cannot move. Placing a triangular wedge would do the same trick. Basically, it would wedge the door from underneath and prevent it from moving. Now a similar effect or a similar door wedge effect is seen even in clinical scenario. Where is it seen? It is seen when there is early loss of lower first permanent molar. Now whenever there is early loss of the lower first molar, there is extrusion of the upper first molar, because whenever there is an edentulous space, the opposing tooth would usually supraerupt or extrude, and the adjacent teeth will end up drifting mesially into that edentulous space. So the same thing happens whenever there is early loss of lower first molar. There's going to be an extrusion of the upper first molar. There will be mesial tipping of the lower second molar. Now when a patient like this comes to the orthodontist, the first thing that one has to do will be to intrude this extruded first molar. Now what happens is that the upper second molar, if you see the circle where it's circled, the upper second molar wedges under the distal height contour of the extruded first molar. So even when the orthodontist attempts intrusion, it is impeded by the door wedge effect of the second molar under the distal height contour of the first molar. So this is the door wedge effect in orthodontic patients who present with early loss of first permanent molar in the lower region. Now in order to prevent this door wedge effect, what we would do is we will have to separate the first molar and the second molar so that intrusion can be easily achieved, or we will have to end up distalizing the second molar so that this door wedge effect is removed. There's something known as a washboard effect. Now if you see the diagram on the left, it's a washboard. Washboard is nothing but a tool that is designed for washing clothes with hand. So it has a lot of corrugations, a lot of elevations and depressions, which give it that rough surface to help wash these clothes. Now a similar appearance or a similar effect is seen even in the lower anteriors. So when is it seen? So in case there is a large overjet, and to correct this overjet, the orthodontist does excessive buccal or labial movement of the lower anteriors into the buccal cortical plate, as you see in that IOPAR. What will happen when such an excessive buccal or labial tooth movement of the lowers are done is that there will be thinning of the gingiva, and there is a partial see-through of the underlying root contour. So if you look at those clinical photographs, you can see that the root prominence is very much. So it gives a washboard appearance. Now why does this washboard appearance happen? It happens because you're moving the tooth excessively against the cortical bone such that it contacts, because of which there is surrounding bone loss or root resorption, which gives that root prominence or underlying see-through of the underlying root contour, giving it a washboard appearance, similar to the washboard that you use for hand washing. So this is the washboard effect. To prevent this, we must actually apply the right amount of torque such that the lower anteriors don't contact the labial cortical plate. Next, let's look at what is known as the trampoline effect. Now we've all had a lot of fun kind of jumping on a trampoline. So what is a trampoline? We all know what's a trampoline. It's that stretched fabric over a steel frame. Underneath there are many springs, coiled springs. So when you jump on it, you're actually jumping high up in the air, like the kid who's enjoying over the trampoline here. Now a similar intermittent pumping activation is seen while we do space closure. Very similar to this intermittent springiness of the trampoline, an intermittent pumping activation is seen during mastication during space closure with active tiebacks. So what does this effect do is that even if the patient who has had active tiebacks for space closure doesn't turn up for follow-up appointments or have failed to present for their routine appointments, space closure continues to occur for several months with these active tiebacks. Now the effect of a trampoline is applied here to explain the intermittent pumping activation, like how one bounces on a trampoline during mastication. So when we are applying masticatory forces, these forces of mastication is intermittent and pumping activation like. It acts on the ligature wire which is there in the active tieback during function, and the chewing stretches out the elastic auxiliary, giving it a pseudo activation. So despite the fact that the patient is not presented for routine adjustments, this trampoline like effect because of the masticatory forces helps in continued space closure for several months even if the patient doesn't turn up. Next, let's move over to the fence effect. What is a fence? We've all seen it in any kind of a farm, or if you want to create a barrier such that, oh, this land is mine or something like that, a barrier railing or any upright structure usually made out of wood or wire, causing an area to be enclosed to prevent or control access or escape. So this is a fence. Now where would we see an effect of fence in orthodontics? So whenever we give patients, say, lingual braces or lingual elastics, what these lingual braces or lingual elastics do is that they fence the tongue musculature away from the teeth. Whenever the tongue tries to contact this, because owing to its discomfort to the tongue, it redirects the tip of the tongue. Now why is it called fence effect? It is fencing the tongue musculature away from the teeth, which improves the anchorage value, but it also eliminates anterior tongue thrust component during retraction. And this fencing away of the tongue musculature away from the teeth is done by lingual appliances, or is seen when a patient is on lingual braces or lingual elastics, where the appliance in itself is telling the tongue to back off and is hence fencing the teeth, and that's why it's called as fence effect. If we consider the Andrews straight wire appliance or the pre-adjusted edgewise appliance, there are two effects that were seen which are very important in terms of examination point of view, and also which helped in developing subsequent straight wire systems like your MBT system. So the first one is the roller coaster effect, and the second is the wagon wheel effect. Now we all love roller coasters. We've seen what they are. They're full of twists and turns. It's like a total curveball. They're so much fun. But in orthodontics, if you see a roller coaster effect, it is not really good. It's not really something that we would look forward to, or it is totally undesirable. And this is exactly what was happening with the Andrews straight wire appliance. Now in the early years, it was the pre-adjusted edgewise or the straight wire appliance that came into picture. So what happened when they used to extract teeth for orthodontic treatment and apply these heavy elastic forces? It led to something known as the roller coaster effect. Now why is it called the roller coaster effect? Now the occlusal plane, we all know, should follow a straight line. Now when heavy elastic forces are applied early in the extraction cases on light arch wires, what happens is that the occlusal plane stability is completely lost. It becomes fully curved, similar to the path taken by a roller coaster. So what are the three hallmark features that happens when the roller coaster effect is taking place? You have tipping and rotation of teeth into the extraction sites. You have anterior deep bite, or the bite deepening anteriorly, and you have a lateral open bite in the premolar region. These are the three most important features that are seen in the roller coaster effect. Why does this occur? It occurs because of applying elastic forces early in extraction cases on light arch wires. Now this was seen when it was seen in the Andrews straight wire appliance or the early years of the pre-adjusted edgewise appliance. Now roller coaster effect kind of helped the MBT system to overcome it, and it is seldom seen because the brackets of the MBT system had a reduced tip. There is lighter arch wire forces. We don't apply these heavy elastic forces, and also to control anchorage we use lace backs instead of a heavy elastic chain to prevent this roller coaster effect, which is no more seen or seldom seen in the MBT system. it was seen mainly in the Andrew straight wire appliance. The next effect that we'll be seeing is the wagon wheel effect, which is also observed in the straight wire appliance or the pre-adjusted edgewise appliance. Now let's see what it is and what actually was happening that time. So whenever they added torque into the arch wire, how was torque added? You twist the rectangular arch wire to bring about certain desired labiolingual movement of the teeth. Now when torque was added to bring about this ideal torque or ideal labiolingual position of the teeth into the anterior segment of rectangular arch wire, they found that the teeth, along with having torque, also kind of lost its mesiodistal inclination. There was a loss of tip. All the teeth, the anterior teeth, when torque was added into the arch wire and it was engaged into the bracket slot, they also lost their tip and mesially inclined. And this always occurred in the ratio of 4:1. For every 4 degree of torque that was added, there was 1 degree loss of tip that was observed. Now, why is it called the wagon wheel effect? Is that because of the arch wire which curves like the main framework of the wagon wheel, and more importantly, the teeth which were supposed to be straight lost its tip subsequently with further addition of torque to mesially incline, resembling the spokes of a wagon wheel, and hence it's called the wagon wheel effect. Next, we have an interesting effect which is known as the watermelon seed effect. Now, this is seen in patients wearing thermoplastic appliances, or more popularly known as the clear aligners. There is some unintentional intrusion that is caused when the tooth distorts the thermoplastic appliance or the aligner when it is being worn. Now, why is this called the watermelon seed effect? Why is this unintentional intrusion called the watermelon seed effect? For that, look at the picture on the right and left. First, look at the picture on the left and imagine holding a juicy watermelon seed, something that is just cut and it's slimy and it's moist. Imagine holding that watermelon seed between both your fingers, and imagine what happens if the fingers are pressed, if the seed is pressed between the two fingers. The watermelon seed is going to be jumping out, or it is going to be expelled, and the arrow marks there are showing the way in which it is expelled, but most common path it takes is a straight path, which is the straight arrow mark. Now similarly, when a aligner is being worn over the teeth, now if the stiff tooth has caused distortion of the aligner, this distortion will cause an unintended intrusion. And how does that happen? The gingival portion of the aligner moves away and is not in contact with the tooth because it's got distorted. And all the forces, if you see the arrow marks, are concentrated only in the occlusal part. And these concentrated occlusal forces causes the tooth to intrude or take the path like that of a watermelon seed when it's pressed between the two fingers. And that's why it's called the watermelon seed effect. Next, we move over to the cue ball effect. So what is a cue ball effect? So whenever we're playing a game of poker, the goal is to be able to pocket all the colored balls. And how do we do this? We do this with the help of a cue ball or the white ball that even has that black dot in it to help aim or help direct the cue ball in a particular desired direction. Now, the force needed to move a cue ball in a straight line without it rotating or moving anywhere to the right or left is going to happen only when you center the force through the ball's center of mass. If it's away from the center of mass, it's going to move to the right or left along with a straight line. Similarly, when you're trying to move a tooth, if you're applying the force through the center of resistance of the tooth is going to bodily move or translate. Now, when the force is away from the center of resistance, it will produce both a translation plus an associated moment, which is a rotational movement of the tooth. Now, if the force is directed through the center of resistance, there is translation. If the force is directed away from the center of resistance, there is translation plus moment. Why is this also called as the carom coin effect? Because the striker is used to pocket the desired colored coin, and it follows a very similar rule of either moving straight through the coin's center of mass, or if it is going away from the center of mass. Next, let's see what is the rowboat effect. Now, you've all seen rowing. When you have to row, you have oars that help you maneuver or navigate through the water. So you move the water one way with your oar, but you observe that the boat moves in the other way. So there is a similar tendency for such a rowboat effect to occur even in teeth. So if you're trying to apply lingual root torque, That is, you want the root of the incisor as shown in the picture here to move lingually. So you apply a lingual root torque. You also see that there is the crown moving in the labial direction, or there's a tendency for the crown portion of the tooth to procline. Now this is called the robot effect in the teeth. And what is the principle that it's based on? It's based on the Newton's third law of every action having an equal and opposite reaction. Now in order to prevent the robot effect from occurring, you use lace backs, or you cinch the wire distal to the molar tube, etc. Now this is called the robot effect. Coming to the last of the effects in this micro lecture is the ripple effect. Now you've seen ripples of water that are being created when you throw a stone into a lake containing still water. You have one ripple that's formed because of the impact of the stone, which causes another ripple, and it causes a series of ripples that is spreading. So in essence, or in theory, a ripple effect is a spreading, pervasive, and usually unintentional effect or influence. A similar unintentional influence occurs in patients presenting with cleft lip and palate deformities. Now you know that patients having cleft lip and palate first undergo their lip repair, and then they are scheduled to undergo their palate repair. Now when they undergo the closure of their cleft palate, or they undergo palate repair, there is post-surgical scarring that occurs. Now this post-surgical scarring, what it does is it causes a ripple effect. It causes an unintentional influence on secondary dentoalveolar and midface growth. It causes a lot of deformities. So it causes both dentoalveolar crowding. There is a collapsed narrow maxillary arch because of this post-surgical scarring tissue, as well as midface growth deformities, both of which are of extreme concern for the orthodontic treatment who is dealing with cleft lip and palate children. We come to the end of this micro lecture. Now if you've paid attention to all the pointers that were shown in each of the slide in this micro teaching lecture, you should be able to attempt a small mini quiz, which is just 7 questions that each statement describes a particular effect, and hope you should be able to answer these. So let's quickly look at the questions, and the answers are not provided here. You should be able to identify these answers. If not, just go back to the lecture and kind of skim through. So the first question is, dentoalveolar open bite closed by retraction and extrusion of anterior teeth is dash, which effect? Second, unintended intrusion observed during clear aligner treatment is which effect? Then, anterior deep bite, lateral open bite, and tipping of teeth into extraction spaces are the features of dash effect. Tongue thrust corrected by lingual appliance is due to dash effect. Early loss of lower first molar that subsequently prevents upper molar intrusion is attributed to which effect? Then, severe lower incisor proclination to correct an overjet or applying insufficient lingual torque can lead to dash appearance or dash effect. Continued space closure despite failure to present for follow-up is due to dash effect. I hope you will be able to answer each of this question. It's all clearly stated in the micro lecture, and we will be seeing a series of further analogies but not effects in the subsequent micro teaching lectures. Thank you.